Okay, so getting into that, we'll be talking this morning about contraceptives and gender selection. Many people say, I want a baby girl. What do I need to do? Do I need to look and make sure it's a full moon and then make... You'd be surprised at the things you hear, my sister. Okay, and so the lady who's smiling and laughing is Dr. Joan Okemo. She is a consultant obstetrician-gynecologist at the Aga Khan University Hospital. Daktari, good morning.
Good morning.
Karibu sana.
Thank you very much.
I'm telling you, people are already jumping on this thing and people want to know, is it a myth? Is it true? Is it an old wives' tale? What is it exactly?
Yeah.
But also contraception, still big ticket issue in the country today. So glad to have you here as you welcome you to the hot seat. It is a hot topic. So let's see if we can warm things up a little bit more for you.
Okay.
And CT will give us today's proverb. See, now you're the expert in these things.
Yes.
And then we'll give you a proverb and then you can now apply your expertise and tell us how you would interpret that proverb and what it would mean to you. Okay, fantastic.
Okay, our proverbs for the whole of this week have been from the People's Republic of Algeria. And today is our final day of these proverbs from the Republic of Algeria. The following week, we'll still be looking at countries in Africa that border the oceans. Okay. Speak kindly or refrain from talking. Speak kindly or refrain from talking. Straightforward, isn't it?
Yeah.
Tell us what you think, Terry.
I think it speaks for itself. I think kindness is something that the world would use today. There's a lot of things happening in the world, and just going an extra mile to be kind will be something great. And therefore, if you are not going to be kind to someone, you'd rather just shut up.
This is true.
Yeah.
Very simple. No embellishment. That's just it, isn't it?
Yeah.
Okay. Let's get into it because, again, big topic. Big interest. Many say that even when you look at the politics of the world, the politics of the nation, this is also the politics of health.
Yeah.
And people want to say, okay, so what do I need to do? How do I need to go about it? You are an obstetrician-gynecologist. Normally, when both of those, we say they're one and the same. But they're not. Maybe we can start from there so that we can understand where we're going. Obstetrician-gynecologist, what's the difference between the two? And how come a lot of people practice them together?
Okay, so they both deal with female reproductive health, and that's why they are all connected. So obstetrics deals with pregnancy, and gynecology deals with non-pregnancy reproductive health. Okay. So they're all sort of connected. That's why they practice together. Okay. Yeah.
All right. Now, one of the things that we look at when we're now dealing with, and you stop me if I'm wrong here, obstetrics is contraception.
Yes.
Okay. So contraception is what you use when you do not wish to get pregnant.
Absolutely.
Okay. Now, could you explain to us this whole system around contraception and how it actually works to stop pregnancy and how long you can have it, or what is available for people when it comes to then family planning or just not wanting to be pregnant?
So you rightly define it. Contraception is any method that we use to prevent pregnancy for one reason or another. Maybe it's undesired, it's unplanned, or you're just done with childbearing, or you don't want children at all. So it utilizes the body physiology around reproduction, and they work in different ways. There are those ones that may stop the process of ovulation, which is necessary for you to get pregnant. There are those ones that may interfere with the environment in the uterus, which is necessary for the baby to grow in. Or there are those ones that may prevent the sperm from accessing the sperm from accessing the eggs, so that fertilization doesn't happen. So there are very many methods available, and they all work in different ways to just try and achieve the same goal, basically. Yeah.
What are the different methods that are available?
So broadly, there are two categories. There are non-hormonal methods, and then there are hormonal methods, and then also there are artificial methods, if I may say, like man-made methods, and then there are natural methods. So natural methods are things like calendar method, just using your ovulation understanding to try and prevent pregnancy without having any medication or any device in your body. And then the artificial methods are any medication or devices that we may use to try and prevent pregnancy. And then the hormonal ones are the ones that have the hormones implanted in them. So they work in preventing pregnancy. They use the hormonal benefit to try and prevent that. And then non-hormonal ones are the ones that they work naturally without any hormones in order to achieve the same purpose as well. Yeah.
Okay. How do you know which one to use?
Well, that's a complex question. The discussion around that is very personalized because we look at many things when you're deciding which family planning is best for me. It really goes a long way on what is your preference as a person. There are people who don't want something foreign in their body. There are people who don't want hormones. There are people who want natural. It also depends on what your reproductive goals are. For example, how long you want to wait before you get children. Maybe you want to wait 5 years. Maybe you want to just wait 6 months. It also depends on your own health situation. For example, if you have medical problems, they can make other methods very unsafe for you, and therefore it may help us to sort of tailor towards what is safe for you to use. So it's a discussion that involves a lot of things from your age to your health status to your social life in terms of things like smoking and also just your reproductive plans long term, and also just personal preferences, and as a couple also what your spouse prefers and as well what you prefer as a person.
Isn't it fascinating that people want children? Some who want children are able to get children easily. Some who want children cannot get children. And then there are those who want children, but they would like the children to sort of like make their way into the world at a different point in time. And then that opens up an entire industry. Yes, and people who will help you achieve these desired goals. Why wouldn't one want to have children?
Like completely, they don't want to have children at all, or they just want to defy it?
Yes, and then why would someone want to limit the number of children they have?
Well, I think partly is also whether you feel like a person you want children or not. The people who they just don't want children, they just don't have. They're not made for it, and it's just their choice. They don't want to have children at all. And also in terms of spacing, like in terms of when you want to have a child, it could be many things. It could be maybe because you already have a child. It could be maybe your financial status. Maybe you're not able to cater for this child if they're born. It could be a relationship situation. Maybe you're not in a stable relationship, or you're not with the right person. It could be just because you want to avoid complications in the event that you get pregnant, because pregnancy also comes sometimes with issues, and trying to avoid that can also help you to just use a contraception and defer the process. Okay. Yeah.
You mentioned some artificial contraception.
Yes.
What are those?
So there are many. There are many. They range from medication, so there are some pills that you can use. It could be devices, for example, devices that we put inside the womb, what we call coils or IUD, or sometimes it could be implants that we place underneath someone's skin, and they stay there and they help to prevent pregnancy, or even things like condoms. They're also artificial.
Okay.
Yeah.
And yet we've heard stories of people who have used this artificial contraception and have gotten pregnant.
Absolutely.
Whether it is the stuff that you inject, or I actually read a story, and it was actually true, that the coil that has been implanted, or rather has been inserted, did not work. And when this woman was giving birth, she birthed the baby together with the coil. So my question then is this contraception that's available foolproof?
So unfortunately, none of them is. None of them is even the one that you tie the tubes permanently, like what you call tubal ligation or vasectomy, is not 100%. So they all have some bit of failure proof.
What are you talking about?
There's some failure rate.
You can tie your tubes
and
permanently, but you can still get pregnant.
You can still get pregnant. Sometimes it fails.
But she just explained it. You tie your tube so that you can get pregnant.
To prevent pregnancy. Yeah. But there are those ones that are more effective than others. There are those ones that maybe a chance of failing is less than 1 in 100 women in a year. And there are those ones maybe it's around 25 women in a year. So it varies and it depends really on what method you've used.
Which ones are these that are more effective than others?
So the ones that do not rely upon the person to remember to use it, or you have to remember to use it maybe every time you have sexual intercourse or every day, they're more reliable. So things like the coil or the implants are generally more reliable.
That you put in and you forget about it.
That you put in and forget about it.
Okay.
Yeah.
So now you've got some boxes on the table, and I was thinking in my head as I saw them, I was like, those look really big. What are you doing with those? But exactly, so the different ones and what they do.
Yeah.
Before we get into that, one of the ones that has really taken the world by storm, especially for younger women, between the ages, the research is crazy, between the ages of 13 and 25, there are girls who are on emergency contraception as though it was regular contraception, but it is available in the pharmacies and the chemists. To anybody who will walk in and buy it, you can actually pick it up. Where does emergency contraception lie in this whole idea?
But is it that you can actually readily pick it up, or is just that people pick it up but it's supposed to be prescribed?
But it is there.
Yeah.
Yes, it's available.
Yeah.
It's there. But it's not Panadol, is it?
No, but it is bought as though it were.
I'm in full agreement with you.
Pharmacies actually said that between Friday and Monday morning, that is the highest sold medication for them.
Yes, I'm questioning the legality of that process of selling it. That is what. Because anything that actually changes your body, that causes, to the degree that it does, so that something that is supposed to be a natural occurrence is averted, surely you need expert advice before you consume whatever that is.
Exactly. So
I agree.
What is this? It's not a phenomenon but what is this that we're dealing with, and how then what would be the advice?
Yeah. So emergency contraception really is, as the word says, is an emergency situation, and it has every advantage if you can quickly access it anytime, anywhere. And we have those ones, like now the common one that you're talking about, the e-pill, that has that advantage. And actually we are allowed to buy it over the counter anytime, anywhere. But also we have other options of emergency contraception that you have to sort of go to the hospital for you to get them. And those ones are prescribed by the doctor, or they are done by the doctor. Yeah, so they are sort of different. The e-pill is allowed for you to actually just go to the pharmacy and get it.
Let me ask the question and why I've taken the position I've taken.
Yeah.
There is no drug known to mankind that doesn't have side effects.
Very true.
Okay, now, when somebody goes and asks and says, I want to buy this, is there enough time for whoever is dispensing it to explain to whoever is buying it what the likely side effects of this particular drug would be?
Ideally, in an ideal world, that should happen, but it doesn't happen. The good news about the e-pill is that the side effects are really not things that are life-threatening. It's things like nausea, headache, breast tenderness, or affecting your menstruation in terms of how soon they come or how long they will stay. So it's not really life-threatening by itself. So it's sort of safe, quote unquote, if I may say. Yeah.
Okay. So let's go back to this contraception in terms of availability, because it would tie into family planning, right? Family planning from this, it's actually carried in one of the dailies today, this whole contraception issue and family planning. That there are many families right now who would want to be able to plan, because they're bundles of joy, children, but they're also expensive. That's the truth.
That's true.
Right?
Yeah.
So there are families now who want to look into that as a way of family planning, but then there's the whole religious aspect, there's the whole economic aspect. So in terms of availability and affordability of contraception, where is Kenya today to then be able to say those who want to be able to access it, and we're not just talking about having a packet of condoms, but if you're saying that you want something that is the one that you can have in and that you can essentially forget about, but you can be sure that it's doing its job, is it affordable for people who would want to then go into family planning to then be able to use?
So they are affordable. Some are and some are not. But if your main purpose is to just prevent pregnancy, really you have an array of options to pick from, including those ones that are very easily affordable, very easily accessible, and those ones that are a bit tricky to access. So there are those ones that are quite expensive, like the Mirena, which is a hormonal coil that you put inside. And the reason why it's expensive is also because of the benefits that it also comes with, beyond just the contraception, because we use it for multiple other reasons in the gynecological world. But most of them are actually easily accessible. Like, for example, we have a lot of these provided in government hospitals for free.
For free? Okay.
Yeah, for free. So you'll just go, and as long as it's available, you'll get it.
Oh, really? So there's no longer that excuse where we said, okay, well, I have to go get an injectable and it costs this amount of money. You can actually go to a government facility and want to be put on family planning or contraception, and you can get it for free without paying anything.
Without paying.
And in this case, free actually means free, because, there are a lot of things that are free that that are not really free.
I know.
Yeah.
Well, it should be totally free, but of course, when you go to government hospital, unfortunately, with the health status in our country, you may find like they don't have gloves, or they don't have a syringe, or they don't have something like that you may have to go into your pocket to cater for that expense.
So the thing is free, but then the process around getting it done, you have to pay a little bit of something for it.
Maybe a little, but it's not too much. Yeah.
Okay.
Yeah.
So what are some of the negative effects of contraception?
So that also varies among the methods. Generally, the ones that have hormones, they tend to have side effects such as, for example, weight gain, changing your moods, giving you things like headaches, affecting your menstruation, in that they can either disappear or they come in a pattern that you can't really predict. Sometimes they can even lower your sexual libido. Yeah, and then something like the copper coil that doesn't have a hormone, it can cause you to have heavy menses, or you bleed for a long time, or it can cause you to have extra cramping or vaginal discharges. Generally around that. So they differ among the methods, different side effects, different methods.
Okay. Yeah. What would be your advice for people, people who are getting into the idea, okay, not quite sure what to do, whether it's like you said, you want to defer pregnancy for some time, whether you want to have a space between first child, second child, or whether you want to say, okay, well, we want to just not dabble for now. What would be your advice, and how would you start off?
I would say start with your own personal reading or some bit of research to just see what is it that you prefer, what is it available. Talk with your spouse or your partner and decide also what can work between the two of you, and then see a doctor to get further advice. So the doctor, when you go to the doctor, they'll try and see, first of all, your suitability in terms of the family contraception method that you want to use. So some methods may be safe for you, some methods may not be safe for you, and the doctor will guide you towards safety with regards to that. So you will need to also speak to a doctor, because you can't just up and go and pick anything that you want. Some may be harmful for you, and you might not have any idea about it. Yeah.
Okay. As we want to come to that gender selection conversation, but before we do that, you mentioned this Mirena, and you talked about it being contraception, but at the same time there are other benefits that it has. What are those?
So Mirena, it has a hormone. It's a coil that we put inside the womb, and it has a hormone. The hormone itself is beneficial in the fact that we use it in some gynecological conditions such as fibroids, endometriosis, heavy bleeding, severe pain, and there are people who have chronic pelvic pain, and this one sorts them out a lot in that regard, just because of the effect of the hormone that it has in it. It's not actually just Mirena alone. Most of the family planning options, they have beyond contraceptive benefits in them. So sometimes actually that may also help us to decide what is suitable for you, depending on whether you have any other gynecological condition that this may be beneficial when you use just beyond the contraception.
I think that's a big thing, because endometriosis, a big many people suffer from this silently, but are actually living lives of absolute pain. Is it well known that this is an option for you to use to deal with the effects of endometriosis?
Among the public, maybe not, but among doctors, yes. It is well known that it's one of the options that you can actually use.
City is looking at me because he wants to ask something. Okay.
This conversation always puzzles me.
Okay.
It really does, and that's why I premise what I said earlier on in terms of people want children, some don't, some have partners. All these things around contraception. My question, aside from the obvious benefits, meaning you can decide and determine when it is you want to have a child, what other benefits are there really?
For contraception?
Yes.
The non-contraceptive benefits, for example. As I said, most of them actually have benefits beyond family planning. And there are some situations where we may initiate these contraceptive options just for those medical reasons, not just for family planning. So...
Okay. At what age should one actually begin getting information about contraception so that one actually understands it?
From adolescence.
Okay. And who is it? Boy child, girl child, both? And what sort of details must be included in this education?
I would say both of them, because a child or getting pregnant involves two people, right? It involves a girl and a boy. So it should start as early as adolescence, because once you've hit adolescence, you are actually potentially able to get children or to make someone pregnant. So what it should involve, I think, beyond just the menstrual health that we do among girl children, it can also involve how to things to do with sex, when to have sex, in what situations, relationships, and the risk that comes to relationships sometimes, such as violence and STIs, and also how to protect yourself from getting pregnant, because adolescence pregnancy is also a big deal, or teenage pregnancies, and it comes with its issues, of course, and that's a conversation that adolescents, well, they're children still, should understand, and also be familiar with what are the options available if at all they have to be sexually active to prevent themselves from getting in such situations.
Oh, that's the ideal situation, but how readily available is this information?
Unfortunately, it's not, but we're trying to do something about it in terms of just public education, talking about it more, trying to empower people in churches and in various groups so that people are empowered and they have this information available, and also, of course, in schools, getting it out there in the schools where the children are learning.
How do religious organizations receive this information?
Well, it varies among churches, among religious groups. There are those ones that are more receptive. There are those ones that they don't want, especially when it comes to adolescents, because no one wants to talk about adolescents having sex, right? People want to talk about abstinence and things like that. And we know that it's not possible for all of them to do that. So it's not a welcome topic, unfortunately, in many religious groups. But there are those ones that are very receptive of it.
In the time you've been in this particular field, would you say that messaging that comes from religious groups is more readily acceptable, or is it that the messages that come from other sources, like, say, the media?
Religion has a way of convincing people and people believing it. As I said, it's the opium of masses. Someone say that, right?
Yes.
So information gotten from religion, because it's a matter of, I think, faith. You don't have to be factual about it. People believe it and they receive it more compared from information gotten from media or medical experts, for example. So I think religious group is one of the groups that we really need to make sure they have the right information and are receptive, because people believe them more people rely upon them more.
So, I mean, there are those who believe that contraception is a contravention of a religious belief.
Yeah.
Yes,
Right?
certain religious tenets.
Yes, that you are playing with the natural way of things by using contraception.
I know.
And so what that has resulted in for a lot of people is repeated pregnancies. Over and over again, women are pregnant, delivering babies, in some cases, unfortunately, losing the baby, which is a traumatic experience physiologically. I'm not even talking about the psychological trauma. What the body has to go through every time it's in a state of pregnancy, or what the body has to go through when it loses a pregnancy, is traumatic physiologically.
Yeah.
Could you tell us some of the dangers related with repeated pregnancy that many would say contraception essentially would take care of?
Beyond just the economic bit of it, the physical bit, that's what you mean?
Yes.
Yeah. So, of course, being pregnant causes a lot of toil on someone's body. It's not easy. It's not a walk in the park. For 9 months, you're pregnant, you're carrying a human being, and it causes a lot of changes literally in every bit of your body, from your blood to how your lungs function, how your organs function, every bit of it. And if you don't have enough time to recover from these experiences, it takes a toll on your body eventually. And also, there are some situations where pregnancy itself puts you at risk of getting, for example, things like high blood pressure or diabetes, and that can kill you. Eventually, especially the more you do it, the more you're at risk of having these conditions repeatedly come to you when you're pregnant, and those eventually can actually cost your life. So it's not a walk in the park to just be pregnant. In fact, there are some situations where if a woman has gotten some medical problems, we can advise them never ever to get pregnant again, because the next time they may be pregnant, it might actually be the end of them.
How do you deal with a situation that becomes sticky when there's an insistence that you should not use some of these methods, but you can actually see that the life of this woman could be in danger?
Well, autonomy is a big deal in medicine. At the end of the day, we want you as much as possible to make your own decisions regarding your health. So we will empower you with information. We will give recommendations. If need be, strong recommendations. We will tell you, we strongly believe you should not do this. But at the end of the day, the decision is with the human being in front of you. Yeah. So as long as you're more than 18 years, an adult, you can make your own decision. Unless it's a child where you may do interventions. For example, if the guardians or the parents are declining an intervention, you can go even through the legal system to overcome that. But for someone who is an adult, really it's just up to them. So you can just rely on relaying the information and try to make them understand why you're making the recommendations that you're making.
The association you belong to is a very powerful association.
Which
the OBGYN Association.
Okay.
Not the Kenya Medical Association.
Okay.
I'm talking about the OBGYN.
Okay.
Have there been attempts to try and influence the education sector to ensure that education, not around contraception, around sex? Because in the absence of sex, these methods are not really very necessary.
Yeah.
Okay?
Yeah.
So I say this because there's always a back and forth again with religious groups, the issue of morality around it, and yet there is the need for people to be informed. Now, the sort of power that association I speak of wields is profound.
Yeah.
Have there been efforts to try and arrive at a middle ground where the education sector can find a way of working with them so that, again, this information is provided or in a timely fashion, so that somebody grows up knowing and understanding that this is what you do, this is what happens. Now, there are those who are of the persuasion that any discussion around sex is not good because it promotes promiscuity. That is nonsense.
Yeah.
It doesn't.
Yeah.
It doesn't. Have there been such efforts?
Other than beyond education, really, I'm not aware of any specific efforts that unfortunately we have made towards doing that. So maybe it's something that we really need to take up. As you say, we are a powerful organization and we can do much.
We have something called the Kenya Institute of Curriculum Development.
Yeah.
Whenever we talk about the things that people need to know, the other day we were talking about the Constitution and the need for it to be part and parcel of the learning curriculum so that children grow up understanding what the Constitution is about and what their rights are.
Yeah.
I say this because with that knowledge, even if someone ventures into risky behavior, they have knowledge.
Yeah.
As opposed to venturing when you
Without
actually have
awareness.
no knowledge whatsoever, or the knowledge you have is incorrect.
Yeah.
Yes.
Very true. I agree.
One of the big issues also when it comes to obstetrics here, from the side of the one who is having the baby, or the ones who are having the baby, is gender selection. Call it an old wives' tale or a myth, but maybe you can debunk that myth, if it is one, that you can actually do something, or you can actually influence or do certain things that will either guarantee that you have a male child or guarantee that you have a female child. Can we look biologically first at how the sex of a baby is determined?
Okay. So biologically, you need a sperm and an egg for them to meet and fertilize. And in these ones, they carry what we call chromosomes or sex chromosomes. A female will carry XX and a man will carry XY. You need one of each for you to make a baby. So the female, being the fact that she produces only XX, they'll always give an X, right? But the man, given that they carry an XY, sometimes they may give an X, sometimes they may give an Y.
Sorry.
Yes.
So women with XX, what they give is that is male.
The X is the female.
The X is the female?
Yes.
Okay.
Yes.
So how is it non-determinant?
So I'll just go back a bit.
Okay, please.
So you need an egg and a sperm to fertilize.
Yes.
An egg carries XX and a sperm carries XY. When they meet and fertilize, they donate one each, right?
Yes.
So the female, being the fact that she carries XX, she'll always give an X at whatever point, because she has two of them and they're both X's. But the man has two, one is X, one is Y. So at some point they may give a Y, sometimes they may give an X. When they give an X and the woman gives an X, of course, that becomes a girl.
Yes.
But when the man gives a Y and the woman, of course, has given an X, that becomes a boy.
So can we say here, for all history and all future, that the determinant of the sex of that baby is carried by the man?
Yes, it is.
Okay.
That is very clear.
Okay.
Yeah.
Do we need to say it again? Because there have been centuries of blame being apportioned, that this woman cannot give me a girl, this woman cannot give me, but it is actually determined by what the man gives.
Yeah.
Okay.
That is very true. And even them, they don't have the power to decide, okay, now I'll give an X or now I'll give a Y.
Right.
Yeah.
So
it's really beyond.
random.
Yeah, it's random. It's random.
So all these people who say they can figure it out for you,
It is all myths.
Okay, so maybe that's where we're getting to now.
Yes.
Because, look, I'll tell you, I have an auntie,
Yeah.
and she actually said, if you do 1, 2, 3, and you do 1, 2, 3, you will get a girl,
you'll get 4, 5, 6.
or you will get a boy. And true.
It happens.
Yeah.
Maybe it's just
Or is it just coincidence?
It's a coincidence.
Okay,
it's a
so
coincidence.
debunk that myth for us based on the scientific that you've given, that XX is carried by the woman, XY is carried by the male. When they meet, you will either get a boy or you get a girl, and it's random selection.
It's random selection.
How then do these myths come about?
So the myths, I think, mostly surround the ovulation process. The fact that you can time sexual intercourse around your ovulation, maybe on the day of ovulation or before ovulation or after. People believe that may influence which sperm or which chromosome the sperm will sort of give, whether it's an X or a Y, and then it may influence the gender of the baby, which of course is not true. Some people have used sex positions or a woman achieving an orgasm as part of the ways to probably get a girl, and sometimes even diet. Some people have said, if you take a lot of calcium, you'll get a girl. If you get a lot of potassium, you'll get a boy. But
there must be something that gives. There must be something that gives that idea, isn't it, Daktari? And what is that? Potassium? You said potassium boy, calcium girl.
Yeah.
What? I wouldn't imagine that somebody sat on a windy day in July and said, okay, let me think, potassium boy. There must be something that leads to that.
So people believing that.
Yeah. What would that be?
People have done some studies in the past, and they sort of gave findings that were suggestive of that as a conclusion. But going back into them, it was found to be very faulty in terms of how the studies were done, the methodology and all those things. It sort of favored the desired outcome of what they wanted to pass as the message. So studies generally that have been done and that are robust, they have shown that there's no way you can influence that, unless maybe you're doing gender determination through IVF, where you actually determine this is a boy, this is a girl, and then this is the baby I'll transfer for the woman to try and see whether she'll carry it to term. But naturally, there's nothing you can do.
And do consider, when it comes to issues of contraception, it comes to issues of having children, imagine a situation where all the social norms that we're brought up with, and then you throw in all the myths and the misconceptions around this thing, and then the desperation when somebody wants a certain, first of all, just child, then a certain gender. You'll believe anything.
You will believe anything.
You will. Because, I mean, it's a traumatic experience that you have to go through, and then not being able to meet expectations. And we can't run away from the fact that the pressure, first of all, to have a baby in the first place, to even get pregnant, and then the pressure to be able to deliver a particular sex, that a lot of that pressure rests on the shoulders of a woman. It doesn't really matter how you're going to look at it today, right? So, if we again go back to the science, some of the things that we hear, X chromosomes swim, or rather X,
Start again.
The sperm carrying the X chromosome swim slower than the sperm carrying the Y chromosome. Did I say it correctly? The Y is the boy.
The Y is the boy, yeah.
So the sperm carrying the female chromosomes swim slower. Is that true? Because what that does is that it gives rise to some of these myths that we've heard, that then the sperm that will carry the female chromosome will reside in the cavity a lot longer, because the male chromosomes are thought to die off a lot faster than the females, and that's why at a particular time you will find that it is more likely that contraception will then happen, and it will be for a girl, or if you ovulate right at the correct time, that the boy chromosomes will be there really quick and that you can conceive. It sounds complicated, but for some people the belief on that is so much steadfast, and they practice to the letter. Are you saying, Dr. that this is all a waste of time?
It's all a waste of time. And it's actually one of the common consultations that we actually get in clinic. People will come and they're really, really desperate for you to give them tips on how they can. It's always a boy that people want, right? It's never.
Why do people want a boy?
I don't understand.
Why?
Because they feel like they'll carry the family name, they'll carry the family traditions, they'll keep the wealth in the family. People have different reasons why they prefer boys. But so it's always a boy that people are trying to get, right? Yeah, so sometimes it's really desperate, because now the man probably is threatening, I'll get a different woman, or
then the woman gives him 6 girls. But anyway.
Or even more. And you try and it doesn't work. I believe that those people who believe it works, it was just a sheer coincidence. Maybe they tried whatever myth they had had and they got a boy or they got a girl, and they thought, it's because of that. But it's actually just sheer coincidence. It doesn't work.
Okay.
Yeah.
It's a random selection. There's really nothing that you can do about it.
Nothing.
If it just so happens to be jiving with the things that you said you did, it just was that.
Very true. It's just a coincidence.
It's a coincidence. Okay.
Yeah.
So even as we continue looking at some of these things, and we're going back to the whole pressure thing.
Yeah.
So because the nature of, having children, the nature of pregnancy is it's individual, it's scientific, it's familial, society, community. It involves all of these things, and the pressure is real for a lot of people. And if we can just a little bit into then how you can actually, people have gone to the extent of making sure that they can actually prescribe what they will get. You mentioned IVF, where there's a selection that takes place, and that selection is done and then put into the woman, and then she gets that. People have gone to the extreme to get that done. Many people have gone to IVF because they're not able to naturally conceive. Are there long-term effects of using contraception regularly, that at the time where you want to withdraw that conception and have children, that then it makes it difficult? can that be connected directly to contraception?
No, it can't. Most of the contraceptive methods, once you're done using them, you're able to actually go back to your natural fertility state. Soon, maybe maximum 3 months. The only one that may delay it a bit is the Depo injection. It's a 3-month injection that you get into your muscle. That one can cause a delay by even up to 1.5 years. But it's just a delay. It's not a permanent change in terms of your fertility. So if you've stayed for more than 2 years after using a contraceptive method and you're not able to get pregnant, there's probably some reason beyond contraception, because none of them causes permanent damage, unless you have done tubal ligation or vasectomy, which is a permanent contraceptive option. But otherwise, the rest are all
then we said it
reversible.
isn't really that permanent, is it?
It has a failure rate. It's permanent, but it has a failure rate of some sort.
Then it can't be permanent, can it? Really?
Well, it's considered permanent because for the situations where it works, you can't reverse it. It's not like a coil where you can remove and you're back to yourself.
I'd like to understand.
Yeah.
How do these methods, for instance, coil, how does it work?
Which one?
The coil. Let's have the coil. It's a coil.
It's a
how
coil.
exactly does it work? How does it help you with the process of not getting pregnant when you don't want to?
So the hormonal or non-hormonal, because there are 2 types, both of them.
Coils now, you always like, do you want green or do you want red? Okay.
Like this one here.
Yeah. So the copper, which is the common one, it's non-hormonal. This is a non-hormonal coil.
How does it work?
This one, the copper effect, well, it looks like a T-shape and it has copper coating on it. When we place it inside the womb, it causes what we call inflammatory reaction that sort of makes it the environment unsuitable for a baby to implant there. So that's how it works.
So essentially it aborts.
No, it doesn't abort. It doesn't abort. It doesn't abort.
The process doesn't even get to a point
where fertilization will happen. So the environment
The
is
environment is
hostile.
not conducive for pregnancy.
it interferes that whole process.
It interferes with the whole process.
All right. Now, so the body understands that it has been interfered with. What if the body never recovers from that interference? So that even when you remove it, now the body is accustomed to doing what the copper told it to do, and now it's simply not playing ball. You are trying
literally not playing ball.
But the effect of the copper is short term. It's short lived. It works as long as it's there. So once it's out, the effect goes with it. It doesn't. Yeah, immediately. There are people who will remove the coil and they go and get pregnant the next month, literally.
All right.
So
and what about the one which is
the hormone? Yes. So the hormone works by, first of all, how can I make it simple? So the hormone works by, it has a hormone called progesterone, and the hormone progesterone causes thinning of the inner lining of the womb. That is how it even we take that advantage when we are managing things like bleeding and endometriosis because of that. So that thinning again interferes with the whole process of getting pregnant, and also it makes the mucus that closes the cervix. The cervix is the mouth of the womb. It makes it thick in that it's almost like a cell. So it doesn't allow the sperm to actually access the eggs.
When you talk about Depo, okay,
the injection,
yes, and you talk about the implant, there are those who have argued that some of these methods are there to empower the woman.
Yeah.
It's not something that the partner need necessarily know about, but it actually still protects them.
Yeah.
Okay? It speaks to the disempowerment that women have.
Yeah.
All right. Now, the question that I want to ask is, when something goes wrong, because none of these things that you say correctly is 100% proof, goes wrong in this sense. It's supposed to work for a certain period of time, and then it doesn't. You didn't
like it fails, you get pregnant.
You
That's
get
what
pregnant,
you mean. Okay.
or you remove it and you're hoping to get pregnant.
Then it doesn't happen.
And now, and now the systems have gone on holiday. You're not getting pregnant.
Yeah.
Yes. Are these not the situations that bring about the sort of disquiet that people have in relationships?
It does. And we get a lot of disquiet even just around the topic of contraception, because there are some spouses who feel like you don't need it or they prefer this method. And for you, for one reason or another, maybe bad experiences, you prefer this other option. Or people who decide to do tubal ligation and the husband feels like, no, we are not done with childbearing. So it's one of the sources of conflicts in homes.
It's interesting because then this brings about the debate of who's in charge of whose body. because the woman may have a very clear idea of what she wants, and they're discussing. But it looks like in an African setting, the final say as to whether you're going to continue having children
is the man.
Yes.
Well, and sadly so, but ideally the woman is in charge of her body because she's a grown up.
Really?
She should be. She should be. It's her body. She's an adult. She can do whatever she wants. It's respectable that if you're in a relationship, you should respect the opinions of your partner. It's respectable that you have such a discussion because it impacts the relationship. But ultimately, the decision is with the lady.
How often do you hear patients who come to you that, this is what my husband wants?
Well, it's often enough.
Yes, exactly.
Yeah.
Because, again, societally, it seems to be the influence of the socialization that people have
how we've
through.
been brought up.
Yes.
Very true.
And yet, when you talk about empowerment, and there's this question of, look, you need to understand how to make decisions that benefit you, it is actually seen as anti-cultural.
Yeah.
And it seems like a messing up of
the norm.
Yes, accepted social norms, which don't necessarily always work in favor of the woman.
I know.
Yes.
But hopefully we change this discussion.
Hopefully we have this discussion because
hopefully we keep having the discussion because the repetition of it is then what starts to sink in the minds of many.
Absolutely. Because we can't keep doing the same thing. Women have suffered a lot. Like by the time a woman decides, I'm going to do this behind his back, she has a good reason.
Why.
She has a good reason.
Top conversations to keep having, necessary to have them, and we're very glad that you joined us in the room this morning. Dr. Joan Okemo, who is an obstetrician and gynecologist. Thank you for being here this morning.
Thank you for having me.
Very important for us to have these and other conversations, so let's do it again in the near future. Asante Sana.
Thank you.
The conversations continue.
This is The Situation Room, the only way to start your day.